everyone, it's game time. Come on in. This is Winning Wednesday. I see you all. Ross, Bright, Tiny B, welcome. If it's your first time joining us, hi, my name is Regina Callion. This is Winning Wednesday, part of ReMar Nurse University, and this is the only place right now on the planet where you can win actual money. People were asking, what do you win? What are we doing? You win money tonight if you have this book and know the answers. We're doing pages 40 to 60 on tonight. It's going to be a good program, guys. Come on in. You need two devices to play. You need one device, like a laptop or a TV or a tablet, and you're going to watch the questions. And then you need another device like your cell phone, and you're going to go to kahoot.it, and you're going to enter in the game PIN. You guys, you need two devices to play. You need two devices to play. All right. And so the PIN is when you go to kahoot.it, the game PIN is 2756779. Yes, 2756779. And so when you are in the right position, you will see your nickname on the screen, and that's all you're going to see. Now, my screen is showing me all the hundreds of nursing students all over that are joining on tonight. So come on in. We got about almost 700 nursing students right now are joining this game. Go to kahoot.it. PIN is 2756779. Today's prizes will be $50 for third place, $100 for second place, and $200. Who can use $200 tonight for the first place prize? Yeah, Cash App only. I am Cash Apping you this money, and I am happy. I paid the $200 prize winner today. I paid the $200. I got the Cash App. It was Patience who won last week. So who is winning this week? I'm excited to see nurses from all over. Somebody says, me, it's me. I'm winning. Come on in. 700 nurses we have reached. Let me know where you're from on tonight. I know we have somebody asks, is anybody from Nepal here? Do we have Canada in the house? I think we do. Yay. That's my neighbor, Canada. All right. And ReMar nurses are passing NCLEX. There's so many things that are happening. Oh my goodness. ReMar nurses are literally passing every single day, studying from the V2. We have about 10 days left of the V2 sale. The V2 sale is coming to an end. So if you haven't gotten into it, you haven't started your study process, this is the time. This is the time. Come on in. I got Massachusetts in the house, Colorado, Maryland. A lot of U.S. nurses tonight. Massachusetts, Texas. Yeah, Alabama, Jamaica, come on in. This is game night. You guys are going to be really surprised to see these questions. I'm going to get started. I'm really going to get started. So get to kahoot.it and enter into the game PIN 2756779. I see you, Philly, in the house as well, Indiana. We're studying quick facts. Now, even if you don't have this book, or if you have the original version of Quick Facts, you can probably find some of these answers in there. It's going to be tough tonight. So this is the book that I actually went with. So if you don't have this book, get it, especially if you're in nursing school. You need to pass NCLEX. This is Quick Facts for NCLEX. You can get it, remarnurse.com. It's also available on Amazon. However you can get it. All right. Going to the board here, almost at 1,000. You guys know I like to have 1,000 nurses. Shout out California in the house. First timer here. First timer, Trinity, it's so nice to have you. Yeah, it's so nice to have you. And how about this? I passed the NCLEX. I took my test June 15th. Congratulations. Super proud of you. Let me know. Are you an RN? Are you a PN? I'm really happy and excited for you. That's amazing. So many people want to be in your shoes. A lot of first-time people joining us on today. And you know what? If it's your first time, let me tell you, follow me, never lose me. Hit that subscribe button because I likes to make sure that you guys are in community events, okay? That you guys are in community events all the time. It's really easy to join. Go to kahoot.it and enter into the game pin 2756979. Now, what's going to happen is you definitely need to have another device where you are going to be watching the answers here, I love that positivity. It's all positive tonight. No negative. We are sending good vibes to everybody that's on this journey. LPN, Bermuda. Okay, Bermuda's in the house. I got so many comments coming in. First timer here in the house. Yes. All right. So again, using your phone and your laptop, or two phones, if you got two phones, go to kahoot.it and enter the game pin 2756779. I'm ready to go. If you are ready, say ready, and I'll know you're serious. I'm trying to stall. I'm trying to stall for all the latecomers that come in. We got about 800. We're going to have to go. How long is the game for? The game is 20 questions. 20 questions. You get points not only by answering the question correctly, but also by answering the question quickly. Okay? Correctly and quickly. So I gotta go, but I gotta read this. Amber, this is so good. Amber sending knowledge, understanding, hope, love, encouragement, and endurance to all of us. Okay? Thank you so much, Amber. Who's winning tonight? Pages are 40 to 60. You're not going to have time to look through those pages. So you either know it or you don't know it. Somebody said, ready, let's go. The agony of waiting. Hey, I'm so happy. Nurse Tillman is a new PN, says, I like V2. It helped me tremendously. Oh, man. NCLEX V2 Next Generation. 10 days for the sale that is coming along. Get in there. All right, let's go. Here we go. I'm starting it. 5, 4, 3, 2. Let's go, everybody. Game night time, June 21st. Here's the first question. Is it for double points? Quiz question. Which of the following is an expected immunization given at 2 months? Is it varicella, DTaP, MMR, or meningitis? Let's get it, everybody. Answers on the screen. I see the answers going in very, very fast. Which of the following is an expected immunization given at 2 months of age? This one should be pretty straightforward. It's coming out of Quick Facts. All right. Varicella. Is it red? Is it yellow? Is it the green or the blue? What say it, you guys? We got nurses watching from all over the planet. A lot of people are saying it's the yellow. Mostly everybody's saying it's the yellow. And we are rolling in. 10 seconds left. Get your answers on the screen. Who is going to hit the first place prize on tonight? Maybe this one was, let's see how many people we got. Most of you guys did get it right. Our top scores coming in. OB, I see you. Almost 1,000 points. Nurse Alexis. DTaP is the expected immunization given at 2 months of age. And we're rolling. Next quiz question is this, coming from Quick Facts for double points. How many days should be in between number 1 and number 2 of the MMR immunization? Is it 7 days, 14 days, 28 days, or 40 days? This one was tricky. It's written in the fine print. How many days should be in between number 1 and number 2 of the MMR immunization? Great question. 7 days, 14 days, or 40 days? Which one? Got to know this. And also remember, measles, mumps, and rubella is what MMR stands 4. Is this a live vaccination? What do you guys know about it? Lots of teaching that is involved. Here we go. 5, 4, 3, 2, and 1. Correct answer is 28 days. The majority of you knew that. Did our leadership board change? It did. I passed today. I see you. 28 days. There should be 28 days or 4 weeks between the MMR dosage. I got to keep rolling on this game. Double the points. Which of the following is associated with ulcerative colitis? Is ulcerative colitis associated with non-smokers, associated with stomach issues, associated with fistulas, associated with non-bloody diarrhea? Ooh. What are you guys going to say about this one? This was tricky. I took it directly from the chart in Quick Facts. See, the whole goal is to make sure that you guys aren't just turning pages, but you're actually committing this stuff to memory. I asked you to memorize it, and I mean it. I mean it. Ulcerative colitis. It's next to Crohn's disease. You got to know the difference between ulcerative colitis and Crohn's disease. So which one is ulcerative colitis? The other is Crohn's disease. Yep. Get out your Quick Facts book. I was able to get most of you guys. The correct answer is actually associated with non-smokers. Leadership board changed slightly. Ulcerative colitis is associated with non-smokers. All of those other things were Crohn's patients. What is another name for a secondary infusion? Is it an IV piggyback, an IV infusion, an IV ringer, or IV albumin? Nurses working on the unit know this. I don't know if I knew this term actually until I got a job. Maybe I did. But I'm talking about a secondary infusion that is hanging with the primary. What would you say? Would you call it red, yellow, blue, or green? Red, yellow, blue, or green? IV piggyback or an IV infusion? Could you just say that? Or IV ringer, IV albumin. This is Winning Wednesdays, the easiest way for nursing students to get paid just by answering the very common knowledge that you guys learned in nursing school. It's coming back to pay, you guys. Here we go. Correct answer is the IV piggyback. Only a few of you picked IV infusion. All right, majority of you did get that right. Leadership board changed slightly. Here it is. IV piggybacks. Secondary infusions are also referred to as IV piggybacks. Next question is this. Quiz time. What should the nurse wear when giving eye drops to a client? Sterile gloves, non-sterile gloves, goggles, or a gown? We are thinking about what should the nurse wear when giving eye drops to a client. Don't worry about the question slides that you see because Kahoot is counting the slides and the answers. Okay, so we are literally on, I think this is our third question. So I'm asking you guys, what should the nurse wear when giving eye drops? Red, yellow, blue, or green? I think it comes down to sterile or non-sterile. That's very important. Which one? Red or yellow? Okay. I know there will be some that may pick blue or green. But listen, picking the right answers is the best way to go. All right, correct answer here is, of course, you guys got it. You know that it is going to be the non-sterile gloves when you're doing eye drops. Leadership board is changing a little bit slightly. All right, here we go. Non-sterile gloves. When you're giving eye drops, you don't need to put on sterile gloves. Quiz time, guys. Which of the following is an example of a hypotonic solution? Yeah, I went there. Hypotonic solution. Is it 0.9 normal saline, 5% normal saline? Okay, 2.5% dextrose water, or 5% dextrose water in normal saline? You might just have to take a stab in the dark with this one. You might just have to guess, get it down to 2 and then go for what you know. I'm asking for a hypotonic solution. Is it red, yellow, blue, or green? This one's kind of tricky. 0.9% normal saline. Is that hypotonic? Less particles. 5% normal saline. 2.5% dextrose water. 5% dextrose and normal saline. Whoever wins tonight surely deserves this $200. You really deserve $200 because tonight was challenging. The more of quick facts we do, the more challenging it's going to get. Okay. We might have pharmacology next week, all pharmacology. Good luck, everybody. But tonight, see, correct answer was 2.5% dextrose water. The majority of you did not get that one right. It was tough for you. Our leadership board looks like it's remaining the same. 2.5% of dextrose water is an example of a hypotonic solution. All right, here we go. Quiz time. IV fluids would be contraindicated in which patient? A patient with diabetes mellitus, a patient with kidney failure, a patient with diabetes insipidus, and a patient with pressure ulcers. Who would we not want to give IV fluids with? This is a very simple question. Okay. Your question that you see, if you see slide 13, that's because it's the rationales are being included. Okay. But the points are only adding up based on whether you get it right or wrong. So focus on IV fluids would be contraindicated in which patient? Diabetes mellitus, kidney failure, diabetes insipidus, pressure ulcers. I see a lot of people picking yellow and I see a lot of people picking blue. All right. So correct answer is actually the diabetes. Okay. I'm sorry. The kidney failure. See, I saw a lot of people picking diabetes insipidus. I want you guys to look that up. All right. IV fluids are okay with diabetes insipidus. Kidney failure though. So IV fluids may be hard to be excreted if your patient has kidney failure. Remember that. The cerebral metabolic rate increases with, is it elevated blood pressure, elevated protein levels, elevated blood glucose levels, elevated body temperature? Okay. We are talking about the cerebral metabolic rate. This was in the nursing priorities. Okay. Is it going to be altered by your blood pressure, your protein levels, your glucose levels, or your body temperature? Who has read the book? Who has read the book and noticed this fine point? Good job, everybody. We got over 700 nurses playing this game. It blows my mind right now. And the answers are coming in really quickly. You got less than 10 seconds left to pick your answer. Make a choice. Make a choice now. Correct answer was it was the body temperature. Makes sense, guys. It makes sense. A lot of people pick blood pressure. Body temperature is actually the right answer. Did it change our leadership board? Still staying the same. Here we guys go. All right. Question, elevated body temperature. So the cerebral metabolic rate increases with an elevated body temperature. And I'm moving on. Quiz time. Double points here. Which of the following medications increases intracranial pressure? Is it morphine? Is it meperidine? Or is it metformin or metoprolol? Very, very important here. I'm asking, which of the following increases intracranial pressure in your patient? Red, yellow, blue, or green? What is meperidine? What is that? What is metformin for? What is morphine for? That's step one. All right, just knowing what those are for. But then you also got to know, how does it affect your patient? And I'm looking for something that's going to increase intracranial pressure. Very important. Pain medicine. Don't want to give it. 3, 2, 1. How do you guys do with this one? I see the comments on the screen. Yes, good job, everybody. Most of you got that one right. Excellent job. I'm looking for some changes in the leadership board. Somebody might sneak in there. So meperidine increases intracranial pressure. All right. All right. Quiz time, everybody. The leakage of a vesicant into intravascular tissue is which of the following? Is it extravasation? Is it infiltration? Is it phlebitis or a hematoma? This is a good one. This was a chart in the Quick Facts book, actually. And it was a chart that had phlebitis, infiltration, extravasation. And so it's like, which one is involving the vesicant into the intravascular tissue? All right. And this is the bad one. Okay. The vesicant is extremely damaging. And so you're going to have the worst symptoms if this one leaks out from where it was supposed to be. Okay. And so you want to know definitely the difference between all of these and your nursing priorities for this patient. Let's see how you guys did. Good job, everybody. Most of you picked red. Red was the answer here. Top 3, Sammy the GOAT, you still holding down 3rd place. I love it. Extravasation is the leakage of a vesicant into the intravascular tissues, not to be confused with infiltration. Different. Okay. When a nurse does a treatment without consent, it is an example of neglect, battery, assault, liable. When a nurse does a treatment, getting into legal issues here, without consent of the patient, it is an example of neglect, or is it battery? Is it an assault? Or is it liable? Love it. Legal issues in nursing, huge. And these are mostly definition terms. So be ready to know the definitions and also pick out examples on your NCLEX exam. I am betting that most people are probably going to go with either blue or yellow. Yeah, we get it down to 2. You have to go with your first mind. That's how you practice these questions. Don't second guess yourself. Correct answer was actually battery, and the majority of you did get that one right. You're actually doing something to the patient. Battery. All right. 3 in a row. Cece, you back in the game. I see you. Battery. The treatment of a patient without consent is considered battery. Quiz time, everybody. Question for double points is: the nurse should listen to lungs from the up and down direction, the up to side direction, the down to side direction, the side to side direction. Which is going to be the best for the nurse to listen to the lung sounds? The up and down direction, up to side direction, down to side direction, side to side direction. Very cool. Got nurses from all over the planet. You will not find a bigger NCLEX study group right now. We have almost 2,000 nurses on a winning Wednesday answering this very important question, because you will be doing a lot of listening in your career. They're going to pay you to listen to people's lungs. Will you be doing them up and down direction, up to side direction, down to side direction, side to side direction? Hey, this is cahoots. Correct answer was absolutely side to side direction. 500 of y'all knew that. Yes, 500 of you guys knew that. I'm looking for this. The nurse should listen to lung sounds from side to side to compare. The reason why is to compare symmetrical lung fields. Gotta know that, guys. Quiz time. Here's our next question. What color is bilirubin? Is it red? Is it blue? Is it orange? Or is it yellow? If a patient has bilirubin, what color are you expecting it to be? Red, blue, orange, or yellow? Which is interesting because the words. I should have matched the words with the colors. I could have did that. So is the correct answer red, blue, orange, or yellow? All right. Yes, I'm sorry. The colors are confusing because they don't get confused. Part of winning. I'm telling you, whoever wins this tonight deserves the money. You just deserve it. Okay. Billy Rubin, what color are we going to be expecting that baby to be if there's too much Billy Rubin? Yellow is the color. Green was the button. Most of you guys figured that out. Critical thinking and nurses can come in many ways. Yellow. Billy Rubin is yellow. Here we go. Another quiz question. Double the points for this one. Which of the following will the client with Huntington's disease experience? Diarrhea, hair loss, jaundice, or memory loss? Huntington's disease. We did a whole segment on this condition. Are we expecting our patient to have diarrhea, okay, hair loss, jaundice, or memory loss? Hey, good job. Part of this whole process is to test your content knowledge. So if I say Huntington's disease, you should automatically know what that patient is suffering from. What are the side effects? What is it? Diarrhea, yellow, which is hair loss, jaundice, or is it going to be green, which is the memory loss for patients with Huntington's disease? Hurry, hurry, hurry. You don't have much time to get that answer in. Patients will have what I was looking for. Yeah, it was the memory loss. It was the memory loss. Over 600 people got that right. And I want to let you guys know, the last time the person that won, their name was not on the leadership board at all, the entire game. And then when it's time to win, I don't know, they popped out of nowhere. So Nurse Alexis, I want to know if it's going to be you. The client with Huntington's disease may experience memory loss. Here we go. Quiz time. In Munchausen syndrome, who should the nurse protect? Is it the airway, the child, the mother, or the other healthcare staff? Patient has Munchausen syndrome. Are you protecting the airway, the child, the mother, or the other healthcare staff? Ooh, this is good. Ooh, this is so good, you guys. You gotta know who needs the protection out of these four things, okay? Munchausen syndrome, who should the nurse protect? The airway, the child, the mother, the other healthcare staff. That's the nurses on the floor, the doctors, okay? Who is the primary person that needs help? And we have the concern of protecting that child, the airway. Some of you guys picked the airway. I knew that would get some people. Correct answer is the child. All right, Munchausen syndrome, the nurse should protect the child. This is something you want to know, okay? Moving on, quiz time. What is the age of onset for multiple sclerosis? Okay, what is the onset of age of multiple sclerosis? 10 to 20, 20 to 40, 40 to 60, 60 to 80. MS, when do people normally get diagnosed with multiple sclerosis? Let me see if I have time to look it up in the book while the thing is counting down. Is this how you guys are winning? You go and you look it up, multiple sclerosis. Oh, you can. You have plenty of time to look it up. I just got out the book. I looked it up. But I don't know if I would be first, though. All right. Correct answer. Red, yellow, blue, or green. ReMar nurses know their content and they win cash. They win cash for knowing it on tonight. This was in the nursing clinical priorities. Correct answer. If you have the next gen, you don't have to guess. It is 20 to 40 here. Okay. And our leadership board is still holding strong. 20 to 40 was the right answer. Next question, quiz time, double points. Neomycin sulfate is used for which body part? Okay, is it the mouth, the stomach, the GI tract, or the feet? Neomycin sulfate. Is it red for the mouth, yellow for the stomach, blue for the GI tract, or green neomycin? Do you rub it on the feet? Well, skincare. All right, or is it the GI tract? Or is it the stomach? Or is it the mouth? What say if you guys today about this condition? Wow. The mouth, the stomach, the GI tract, the feet. So much. Neomycin sulfate. It is a very, very, very powerful, antibiotic. Yeah. So where would you put it? And what is the purpose of it? Correct answer. Majority of people picked the GI tract, but it was a half and half between the mouth and the stomach. Actually, let's see, did our leadership board change? Not too much. FKK is making a comeback. Neomycin sulfate is used to reduce the number of bacteria in the colon. So the GI tract, yeah, that's what I was looking for. Quiz time, we are moving. Which of the following is a contraindicated for a nasogastric tube? Is it nausea and vomiting, chest pain, deviated nasal septum, or mouth ulcers? Patient is supposed to get a nasogastric tube, but they can't. Why can't they? Is it nausea and vomiting? Is it chest pain? Is it deviated nasal septum? Or is it the mouth ulcers? A lot of these are very valid concerns that your patient probably will be dealing with. Very, very valid. But only one is going to stop you from following that doctor's order. Which one is it? Which one is it going to be? Okay. Here we go. We have a lot of people picking the right answer, actually. A lot of you guys are picking the right answer. One person got distracted by my distractor. More than one person. Nausea and vomiting was the distractor. Deviated nasal septum was the right answer. The majority of you did get that answer right. That was easy. Deviated nasal septum. So conditions that contraindicate an NG tube are facial trauma, swollen or deviated nasal septum. Yeah. Facial trauma, you can't do it. Double the points. Aspirin toxicity will cause which of the following? Is it rash, tinnitus, heat stroke, or diabetes mellitus? Aspirin toxicity. Aspirin toxicity. I didn't really put any distractors in this one. This one is just, you just got to know it. You got to just know this one. Rash, tinnitus, heat stroke, or diabetes mellitus. You take too much aspirin, you're going to have this problem. No doubt. This will be a challenge for you. Okay. And this is really interesting because it can happen to anybody. Okay. It can happen to anybody. So you really want to be careful with how much aspirin you take, especially the older you get. Your body becomes really sensitive to it. Less than 5 seconds to get the answer right here. Aspirin toxicity. You are worried about what? Yes, you guys understood the assignment. Worried about tinnitus. Worried about tinnitus in the ears. Yeah, worried about tinnitus in the ears. Okay, quiz time. Which of the following is used to treat Lyme disease? Is it red doxycycline, yellow beclomethasone, blue loratadine, or green codeine? Oh, these colors. Okay, talking about Lyme disease, what's the treatment? Is it doxycycline, beclomethasone, loratadine, codeine? Here we go. This is content. This is straight content. And there was only one type of medication for adults and one type of medication for children. And if you don't know, that's okay. Just say, hey, I don't know, but I'm here to learn. I'm glad I'm here because now I know. All right. So we're talking about Lyme disease. You just have to know the basics of this condition. If you don't know this condition, get quick facts. Get quick facts. Correct answer is red. Yes, good job, ReMar nurses. A lot of you picked it. Doxycycline is used to treat Lyme disease. Game night podium, guys. Game night podium. That was it. Hey, Sammy, I passed today, and our number one winner was Nurse Alexis. Did win. Congratulations. This is what it's all about, coming on here and making your intentions known that you are here to pass NCLEX. Everybody say congratulations to our winners on tonight. They showed up, they had the answers, and they are ready to go. Guess what? Guess what? Congratulate these winners, because next week, actually, we have 2 game nights, okay? We have 2 game nights. We have a big one on Monday. All right. Our game night on Monday is going to be at 8 p.m. And that will be over all of ReMar Nurse University information. So I'm sweating doing this one. But you guys know we've been doing patient care for ReMar Nurse University. And June 26th at 8 p.m., we are doing a massive game night, like massive. And I don't even know the top prize. I guess I was saying the top prize was going to be $500, but I can't wrap my mind around that. So show up. I think the top prize is going to be $500 though. That's Monday at 8 p.m. And then we're doing another game night on Wednesday at 9 for Winning Wednesday. So next week is huge. Trust me, if this is your first time, consider this a practice run if you didn't win. But congratulations to our winners on tonight. Make sure you screenshot your podium. You send it to my email address so I can get you paid, all right? Because you deserve to win for the studying that you have done. Now, so let me just do housekeeping. So next Monday, I will be getting questions from this book, okay? Next Wednesday, we are doing pages. We are doing pages. Are you ready? We are going to do stuff from the entire book. So all the pages, just have them all, okay? I'm going to be pulling stuff from this entire book next week. And so that includes this section here. Okay, that includes this section here. I might need to add more questions because usually we've been doing 20 questions. I might have to go for the gold. Okay, I might have to go for the gold. I don't know. Here, maybe I'll do a 50 question game night. That is ReMar Nurse University. Are you guys excited about that? Do you want that? Do you want me to do the entire book? All right. Is that too much? Is that too much? I'm challenging you guys because it very well could be the final game night. I don't know, but I want to make sure that you guys have this book because that's very important to me. What of the other quick facts that we bought? So if you guys have the 5-star, come to play. Just come to play because I'm sure a lot of the information is in both books. Okay. A lot of the information is in both books, but I cannot guarantee all of it. Okay. I cannot guarantee all of the information will be that book. So somebody said, not too much, not too much, not too much. Okay. I can try. So, somebody is saying, give us less time to answer. So right now you guys have a minute. Next week, I could do 30 seconds. What if I did 30 seconds? A minute. I mean, it's going to be harder. It's going to be harder. Would 30 seconds be better? I don't know. Let me know. Okay. You said, make it harder. Somebody said, no, more game nights. Okay. So 30 seconds, or somebody said, no, same time, 1 minute. It takes me that long to read the questions sometimes. All right. We'll take a vote. We'll go through. Somebody said more time. Give me 2. I think you can do 30 or a minute or 2 minutes. Nurse Brielle says, I passed NCLEX this Saturday on my first try using ReMar V2 and attending the study sessions and game nights. Thank you so much. Thank you so much, Nurse Brielle, for coming and also for studying with me with the V2. I appreciate you giving ReMar an opportunity to be your instructor for the process. Okay. All right. Yes, no, let me know. It's either 1 minute or 30 seconds. Congratulations, Nurse Brielle. People are saying that's awesome. They want to know the details. How many questions did you get? Did you do all of V2? What I want to know is how long did it take you to do V2? All right. How long did it take you to do V2? Hey, if you don't know what V2 is, people are asking and saying about V2. This is my segment where I talk about V2. Ask me anything about my program. Because right now, this is how ReMar nurses are passing the NCLEX with V2. Okay, V2. So ask me anything. First question I see is how much is V2 right now? And this is what I'm telling you guys right now. The V2 is get it done, $89 for 3 months access of the V2. And it's going to include all of my lectures. Okay, all of my content lectures, plus quick facts if you don't have it, and the downloadable workbook. This is huge. I am trying to get you guys licensed as quickly as possible. And the way that you guys do that, honestly, is by having the lectures. There is a huge benefit to having lectures for your content. And these are the lectures that I want you guys to get into. All right. Less than 4 weeks, 2 weeks, sometimes even more than that, to get this content. I said this today. For those of you who have taken NCLEX and failed, this is my best advice for you guys. The advice is to fail fast. It is to fail fast, which means that if you have taken NCLEX in the past and you have not been successful, try again as soon as possible. Do not wait in order for yourself to feel like you're ready. Dive back in, okay? Start all over again. I know that seems like a lot, but it's not if you have a plan. Start all over from the beginning because you're going to get a brand new test. Even if you fail NCLEX 1, 2, 3, 4, 5 times, it should not take you longer than 4 weeks to prepare, okay? Because your program that you're doing is supposed to give you an outline, of what you're supposed to do. So like the study calendar for V2 is going to tell you every day what you should be studying. And for those of you who have purchased V2, please use the study calendar, okay? Please use the study calendar. And I know the 45 days to wait is a long time, but if you are doing something during that time, it helps make it go by so much faster. And so you should have a structured plan. All right. You should have a structured plan, what you're going to do. I like this. This is my process. You watch something, you read something, and then you answer it. Okay. You watch something, you read something, and then you answer it. Now, Nurse Brielle says this. She says, thank you so much. It took me 3 weeks to do V2. Perfect. It took you 3 weeks to do V2. That's what I'm talking about. I got 85 questions and it took me 2 hours. So much of it was case studies and content helped so much. Yes, that is the formula. You guys have to know the content. V2 does have the next gen case studies and question bank included. And I think that that's also a very big part of what your studying should be. A part of your studying should be a question bank, and not just any question bank. You need to do those case studies because you need to know if I am doing a case study, it takes me 6 minutes to do it. If I'm doing a case study, it's going to take me 5 minutes to do it. The more you expose yourself to the case studies, the more comfortable you will be. Okay. Very important for you to do that. But if you cannot articulate the content, all right, if you cannot get through the content of whatever NCLEX review you're doing, and you're just focusing on questions and not watching the videos, as a repeat test taker, you're not doing yourself any favors. If you are a repeat test taker and you're only doing questions, then you're not doing yourself any favors. You need the lectures. That is what helps you to see the entire picture. Okay. One of the problems of repeat test takers is that they focus on the past. So they focus on whatever they felt like their weakness was the last time they tested. So if they didn't know pharmacology, then they study real hard on pharmacology. And then when they take NCLEX again, there's not a lot of pharmacology because you have a new weakness that the test is identifying, okay? You have to be able to see the entire picture of nursing, right, Nurse Brielle? People want to know. Don't go anywhere because people want to know how many questions did you have. Somebody asked about the V2. Can you postpone it? Yes, you can postpone the V2. All right. And I want to show you where you do that. When you go to remarnurse.com, let me go up to the top of it. When you go to remarnurse.com and you click on, let me just go here. All right. You click on whether you're an RN or a PN. Okay. Click on whether you're an RN or a PN. I want to show you how you actually postpone your, in private browser, how you actually postpone your V2, because you can postpone it up to 90 days if you want to just take advantage of the sale portion and you don't want to start right away. It's very important. Okay, so let me show you guys. I'm just going to go to remarnurse.com. Okay, when you get here, you're going to either say I am an RN or I am a PN. Okay, go to RN if you're RN. Okay, and it's telling you the sale is going away. You got 9 days. All right, so when you go to RN, you're going to go to the V2 course. What I want to show you, click buy now for $89. What I want to show you is how you delay your course. Okay, so you put in your information. Now, what you can do, a lot of you guys already have the Quick Facts book. So if you take away the Quick Facts book by clicking on the red button, you're going to get an even discounted price. So that price is going to go down to $69. So what you can do is you can add the printed workbook, okay? If you want me to print this workbook out and send it to you so you don't have to print the downloadable one, okay? This is the downloadable one that comes with the course. If you get V2 for $89, you're going to get this downloadable one, but you have to print it out, okay? You have to print it out yourself. I can print it out and send it for you, but you have to add it on, okay? I'm going to put Bria because she's answering you guys' questions. If you want me to print this one out for you, just add it on, okay? And it'll say physical workbook. So this book is $35. So when you add this one on, then it will bring your total up to $104, okay? But that is when you subtract the Quick Facts if you already have it. Now, when you add Quick Facts, it's going to be $89. So for $89, you're going to get Quick Facts, you're going to get the content lectures, and you're going to get the downloadable workbook. Everybody have that? Okay. Somebody said, yes, can you please print it out? Can you please print it out? Okay. So just add the book. Add the book if you want me to print it out and send it to you. I'll send it to you with the Quick Facts book, and you can get both of them together. All right. I saw somebody say that they did not know that lectures came with this program. Yes, lectures come with this program. It is very important that you are prioritizing the lectures. So the whole goal of how V2 works is you are watching the lectures and you are filling out your downloadable workbook. Yes, okay? And we do ship internationally. And it does cost. You have to, if you're international, you have to have your product shipped. Okay. All right. All right. I'm just, Brielle, you can just feel free to put whatever you want about your experience and I'll try to post it. Okay. So that's the goal. You're watching the lecture videos. And you are getting through the program. Now, Brielle says she did it in 3 weeks. Okay. Let me go back because I did say that I was going to talk about, I was saying I was going to talk about how to postpone it. That's what I was supposed to be doing. So let me go back to postponing it. How do I get there? Thank you, Brielle. Okay. I used my Quick Facts on the first try. Already bought Okay. If you want to know specifically about your account, please send me an email at support@remarreview.com. Send me an email, please. And Team ReMar will get to it in the order that we receive emails. Okay. How much is it to print the book? If you go to like a FedEx Kinko's to print this book, I think somebody said it's 121 pages to print this book. I'm assuming it'll probably be about, I don't know how many, like $35, $45, probably the same. Honestly, I have a printer at home, but if you print it, it's probably going to be about the same. But the book here is $35. What I mean about postponing the program, I mean that you can actually delay your start date, because with the sale price, you're going to get when you go to get the course, you're going to get 3 months access right now. Okay. You're going to get 3 months access. Oh, wait, I'm sorry. It's logging me in because I got to go to another browser because I'm already signed in. So you're going to get 3 months access to the program. And that's what will be changing in 9 days. Actually, it'll be changing 9 days. So you won't be getting the 3 months for the $89. That's why I really want you guys to get the sale price of this. And even if you delay it for a future date, that's okay. Because when you delay it for a future date, then your 3 months won't start until that activated date. So if you say, I don't want to start until September, July, August, September. If you don't want to start till September, then your 3 months won't start until September. So that extends you to October, November, December. That extends you to this December for you guys, for those of you who are graduating. So think about how much money you're saving when you do that. Okay. Somebody says it's best to just order it because it's just about the same or a little bit more with taxes and fees at Staples. And that's what I think too, because you're at least getting, like, it's when I send it to you, it's already bounded together. So you don't even have to put it in a notebook, because I'm doing that for you. Okay, so let me put this in. I want to show you guys how to, okay, I'm back again. I want to show you guys how to delay your start date. If you order this tonight, you go to get V2 course. It's a little box at the end of the checkout. Let me see if I can get to it. It's right here. It says click here. It'll show you the price, $89. And then you click here to delay your start date. And this is a typical calendar. So you can just click the over and let's see how far we can delay our start date out to. You can almost start this if you don't want to until the end of September. That is amazing. Okay. So this is how you delay your start date. And you can pick it here and just put done. All right. Or, if you want to just start next month or the 4th of July or something, you can change the start date. But this is where you do it at. All right. So that's it. What do you do if your school is not listed? I don't think that's mandatory. You don't have to put your school in if you don't want to. Okay. So if you are in the free trial, okay, yeah, if you are in the free trial and you want to take advantage of the sale, you have to go to My Accounts. Let me show you how to do that. Let me show you how to upgrade from if you're in the V2 trial and you want to upgrade, go to My Accounts. It's under settings here. A lot of people ask me, do you automatically get access to the question bank? You do. Your question bank is right here. So you have courses, question bank, and file vault. Oh, wait, they say, is Brielle, are you coming on? They say special guest Brielle is coming. What? She's here already? Oh my goodness. Hold on, y'all. I got Brielle. I need you guys to get your questions ready. Hold up. I need you to get your questions ready. Team ReMar works so fast. Brielle, I don't know if you're prepared for this. I can't believe it. I got to check her audio. Let me see. Is this the way I do it?
Yeah.
Okay. All right. There you are. Hi.
Hi. How are you?
Doing so good. What are you doing? Going on here, y'all, we got Brielle, a live ReMar nurse. Goodness gracious. Okay, so tell me about it. Tell me
Yeah.
what you want to say.
So I heard about this program from someone in my nursing school. So I decided, okay, I gotta invest in myself, pay it for the sale price, which was awesome. And I started about 3 weeks ago, really like 4 weeks ago, because I finished about a week before I scheduled my NCLEX. And
Yeah.
I filled out the workbook. I did a majority of the Q bank, and I also did the CAT exam, and that made me feel like I was ready to take the test.
Oh
Yeah,
my.
so I got my ATT on Friday, June 16th, and I scheduled it on June 17th. So, like, it definitely made me feel very confident in order to jump in right into it.
What? Okay, wait. What's your story? Where are you at? What state are you
Right
from?
now, I'm in Milwaukee, Wisconsin. I accepted a job in Seattle, Washington, and Antietam. So I'm
You're
very excited.
moving.
Yes, yes.
But you have family there, or are you just gonna
No,
go out?
no, no. Me and my partner are moving out there together, but it's very exciting. Yes.
I know it's so much better. What were you doing? What were you working before you got a maternity nursing job? What were you doing?
I'm doing my MSN program, my MSN RN. So
Yeah,
I think that might have helped me get into maternity. But
nice.
I was a CNA in a nursing home, Alzheimer's and dementia, but I haven't had much experience with maternity, just my OB clinical. So I got very, very fortunate with that job. And that's part of the reason I am moving cross country too.
No, my goodness, congratulations. And no,
Thank you.
I'm telling you, the need for nurses is so like it is crazy. You are in the best field possible.
Yes.
Yes, and I mean I wish you all the best, but we got to know
Thank you.
more. Somebody
Yeah.
says, were you nervous when you took the exam?
For sure. I mean, I think that's healthy though to be nervous, but you have to be confident in
Yep.
your answers and not
Yep.
second guess yourself. And also like take your break. Like I did take even though I had I had 5 questions left. I didn't know that at the time, but it was question 80. My break hit. I'm going for the break. Like I need my snack, I need my water. Take your break because you do have enough time in my opinion. You have enough time to even if you get 150 questions, you have enough time, take your break and I think then it's okay. Yeah.
Real nurses,
Yeah.
getting it done. I want y'all to know that every ReMar nurse that comes on here is like literally like a real not paid person. Like,
Yeah. No, I just got this invite and joined. Yeah.
Can you touch on the case studies and how V2 helped? Can you touch on the case studies and how V2 helped?
Yeah. I think just knowing the content and really watching those videos and taking notes on those videos and then studying your notes for those videos, that's how it helped me with the case studies. There was way more case studies than I expected there to be. I'm not going to lie. I'd say 40% of my test was case studies. I don't know if that's how it's going to be for everyone, but I personally find the case studies a little bit easier because even when I'm doing practice exams, at least I get partial credit. I don't lose all points the majority of the time. So it did make me feel like, okay, I got this, but I was shocked with how many case studies there were. But I think just reviewing that content, taking the notes, quizzing yourself on those. I made Quizlets of my notes. That really helped me to succeed with all those case studies on there.
Yes, Brielle. Somebody asked, was this your first time taking the NCLEX?
Yeah. Yes, this was my first time, so I'm very excited. It's done.
It's done, over and
Yes.
done. And then they asked how long between graduation and NCLEX. Well, I guess you took it right away. You actually
No,
took it
my
right away?
graduation was May 20th, but then I took it as soon as I could. My school, like as soon as my school submitted my official transcript, I applied the day of, and that's how long it took for the state of Wisconsin at that point to get my ATT to me. So
okay, so you were fresh out of nursing school. You were fresh out of nursing school, but you still felt like you needed more content.
For sure. Yeah. I felt like because I was in this 2-year more accelerated program, sometimes it was hard for me I always, I could get good grades on my tests, but then it felt like this information was just leaving my brain, So I felt like I really needed to do a refresher and full studying 3 to 4 hours a day with this program. Or, when I literally was up till like 1 a.m. doing it on Friday, just reviewing some videos I knew I needed extra help with. But yeah, it
Wow.
was just, yeah, so.
Did you read all of Quick Facts?
Yeah, vast majority of it. I really think I did read all of it. I'm trying
Okay.
to remember. I definitely was more into the videos because I'm more visual, and I think it's really helpful. Like, I don't know, the videos are not, they're so like well presented with the graphics and stuff that I get like my brain turns off after I read a page for a certain amount of time. So the videos are more my speed. Not saying the quick facts isn't great, but like,
Yep.
videos for me are more helpful.
I'm telling you, they really do make a difference.
Yeah.
Somebody asked, did you follow the schedule or fill out the book and then study? Did you follow the study calendar, or did you just kind of do it how, your own way?
I kind of did it my own way, but used the study calendar as a reference,
Okay.
because some days I had more time than others and I got way more ahead of the study schedule, and some days I didn't do anything. So, like,
Yep.
you know what I mean? I used it as a reference for sure, but it was helpful to make sure I completed all the programs. Woo.
Oh my goodness. No, that was fine. I'm just trying to get like all the good people are just asking you all kind of crazy questions. So I really appreciate your time.
Of course. Sorry, my TV just turned on because I'm so sorry. I just turned it off. I don't know if you guys could hear it, but
yeah, we definitely heard it.
sorry.
Somebody said, would this would have been helpful to you in nursing school, or should they wait till after nursing school? What do you think? Did you learn a lot of new things in V2 that you didn't learn in nursing school, or how do you feel?
Yeah, I think it would be helpful during nursing school. You could watch the videos as like, you're in your maternity class. You could watch those maternity videos, and I think it would be beneficial. Yeah, I don't think that should be your end all be all though, because every nursing school is different with like what they want, what they require. But like, yeah, it definitely would help, I would think. Yeah.
Okay. And did you show up to Monday Motivations and Winning Wednesdays while you were studying?
Yeah, and I liked it too. I'm always trying to win. I got to 12th place once. I felt so accomplished, but that's why, like, congratulations to these people that get first, second, third. That's nuts to me.
Yeah, it's tough. It's really tough. Oh my goodness. Okay. Is it, let's see. Can you talk about pharmacology?
Yeah. So most of like I say the first like 60 questions was easy pharm, and I knew it right off the bat from Quick Facts. But like all my friends that have taken the NCLEX too, if you're doing well, those last 20 questions are terrible. They're all like, they make you feel like you failed right at the end. And I really did think I failed. I cried like out of the way. I was like, oh my God, literally all select all that apply on random medications. And the only thing that saved me was just using the suffix of, like, okay, this is in this class, this is in that class. And that's it. And I kind of had to like, okay, this is what, nausea and vomiting. Okay, I guess that's it. So, I mean, don't get discouraged when you're in those last 20 and it gets like that. It's actually a good sign. Yeah. So, yeah, I don't know. Pharm is definitely, I think, my weakest area, but try to remember the suffixes, because I think that helps when you're like, have nothing else left. You don't know what the med is at all,
I love it. People are asking, I see this question a lot, Nurse Brielle, and I think it's different for everybody, but for some reason, people want to know, how many questions did you do a day?
I did so many some days and then none other days. Like, it just depended. Sometimes I would literally be like having a National Geographic on my TV as like a little like background noise and do like 500. And some days I do like 60. So it's kind of hard for me to say. But I definitely tried, especially when I knew some of my friends were getting their ATTs. That's when I was consistently doing 100 to 200 a day. So
like, it really blows my mind that you got your ATT and then was just like 2 days later, like, I want to get this done. Like, I just want to get this over with.
Yeah,
man,
I had to.
that is amazing. But that to me says that you were motivated, you were ready. I don't know if you had an intention to move to another state, but like, what was your motivation?
That was definitely part of it, because I'm going to be moving from Wisconsin in 6 days to Washington. So I didn't want to take it when I got to Washington, because then it's just like one more stressful thing I have to worry about. So I kind of decided, okay, now's the time. I gotta just jump in and take it. Good thing I've been studying, otherwise might not have turned out this way.
Yes.
So,
Okay.
yeah.
Yeah. Talk to them, talk to everybody here about the investment of $89. And those who are thinking like, I don't know if the $89 is worth the investment. I just don't know.
Yeah, I definitely think it's worth it because you get, not only do you get like a Q bank, which is really helpful, you get that CAT test, which made me feel more confident in, taking the NCLEX, and then the videos are just like really well produced and they're not like boring. There's no like, I don't know. It's a good program overall, and $89 really is not too expensive to just invest in yourself, and it will feel a lot better to pay $89 than to fail. So that's how I looked at it when I did it.
True.
Yeah.
Man. So I don't know. I just have to say, like, congratulations. It seems like you're on the fast track to a whole nother life.
I know.
And it's like I'm excited for you. I'm happy for you. I don't know what's waiting for you in Washington, but like as a nurse, I know you can do like extremely well.
Thank you.
So congratulations. Thank Nurse Brielle so much for being here with us tonight. She's a busy nurse and she's taking her time out to just come back and say, hey guys, I did what you guys are currently doing and I passed NCLEX and now I made it. So
yes.
I so appreciate you. God bless you for everything.
Thank you.
And congratulations, because you put in the work and it showed up. You guys take it from Nurse Brielle. All right, I'm gonna give you just final words to anybody watching that's about to test. What would you say to them?
You got this. Confidence is key. And do your study plan. You don't have to follow it exact, but as long as you do all the videos and try to do as many question bank questions as you can, you'll be good. And just walk into that test thinking you own it and you got this. Bring your snack, bring your water. And honestly, I didn't know you could go to the bathroom during the test, and you can, because that happened too. So just do whatever you have to do during that day, and you got this. Another thing I do want to say is too, I used the Pearson pop-up trick because I was so anxious, and it worked for me, and it worked for all my nursing school friends. I'm not saying it's 100% accurate, but it helped me get a little bit of calmness. So, if you want to do that, it's up to you, but I did it and it worked. So,
amazing. Amazing. Thank you so much. I'll be here. I'll be messaging you soon because I really appreciate you coming on here. So Nurse Brielle gave you the words to motivate you. Good night. See you later. Man, you guys, I love it. I love when this happens, when we're in the middle of something so amazing as Winning Wednesday and we have a real ReMar nurse coming on and just saying, I did it, and so can you guys. Wow. What else? What else? What else can I say? That was Monday motivation. That was Winning Wednesday Monday motivation. Nurse McNair, ReMar prayer, quick facts calendar, and book. MW study group was the truth. Oh, okay. Monday motivation with my study group's truth. I passed NCLEX RN with 85 questions. Thank you, Professor Regina and ReMar. Wow. Oh man, you want to come on? We got questions. Let us know. Let us know. RN spinning the block. Every ReMar nurse that comes back, you guys, I'm telling you, it just blesses me to know that you guys are really out here passing. And I'll say this, the sacrifices that you guys are making, that's what shows up on your test day. When you're nervous, when you're panicking, when you feel like you're failing, what will come out is whatever you've been doing. It will be your routine, your schedule, your sacrifices. That is what shows up when you are in a process. But if you're not doing anything and you're not consistent and you're all over the place and you're not focused, you don't know your content, when you get nervous, that's what's going to show up. That's what's going to come out. So I cannot stress it enough. If you have If you have a goal in mind, do what you need to do. I like this. Future nurse Marie says, I have ADHD. I started my V2 today. After failing the NCLEX 3 times and 3 different reviews, V2 is the first that I truly understand. You're like me. You're like me. I love this because I'm the type of person that if I don't connect with it within like 3-4 minutes, I'm out. Like I will go. There are many a days in nursing school I left class and I said, I will read this myself at home because I cannot sit through this lecture. Well, I'm the only one that kind of skipped class. Like I skipped some nursing classes because I cannot learn under certain environments. If you are studying from an NCLEX review and the review, the lecture is 2 hours, get out of there. Okay? Get out of there because you're just going to get bogged down with that content and you're not going to make progress. You're not going to make progress. Okay. Whew, that was so good. Brielle. Okay. Brielle is she's coming back to us. The Pearson pop-up is when you try and re-register for the NCLEX, like you try and reschedule your exam, and then you enter your credit card information, and it says you cannot reschedule. Like it won't let you reschedule for a new exam because the legend has it that you will not be able to reschedule something that you have already passed. So that's it. Okay. All right. So that's it. So, okay. All right. Let me know whatever other questions you have. All right. But anyways, this is it, guys. This is the opportunity. This is the time now where what separates you and from that next adventure is your nursing license. So kick everything to the side, do something that you probably rarely do, which is prioritize yourself and get in this program. Okay. Get in this program. I really, really want everybody to have the same testimonial as Nurse Brielle. So whatever is blocking you from getting to that next level in your life, because it's truly a next level. When you have your nursing license, it changes where you work. It changes what you drive. It changes the food you eat. You don't have to do the 4 for 4 no more. You can literally go down, sit down somewhere, have a Caesar salad. Get some, my favorite water, Aquapana, my favorite, okay? I didn't start drinking Aquapana when I was in nursing school. Couldn't afford it, okay? When you have your nursing license, it is like going from coach to first class, literally. And this is before you get a job, okay? Brielle, I love this. It's so true. Brielle, you're ready for your Aquapana. Life feels so differently already now. It's it. And this is the thing. You guys already have the education. You just need to get started. You just need to start getting paid for it. Okay. All right. You just need to start getting paid for it. Somebody says, I'm done with the 4 for 4. I know. You got to let it go. But right now, if it's in your budget, it's in your budget. But I'm just saying, when you get your nursing license, you get a new budget. Brielle is a millionaire. Okay. She's going to start living a millionaire life. In about 10 years, she will have made $1 million. Absolutely. Okay. Nurses are starting off making $70,000, $80,000. Okay. 10 years, that's $800,000. That's a lot of money. All right. And so what I'm trying to get you guys is to see is the big picture. Right now, you may see and feel like you're stuck at this one level, but if you just do what you need to do, you will go up. Okay. You will go up. Get into the V2 lectures. I love y'all coming here. I think it's great, but this is where you need to be. Okay. You need to be watching these. You need to be, in this, you need to be working this. This is where you need to be working. All right. Work these lectures because this is how you get to see the big picture. And as you guys can see, it's not a lot. It's really not a lot. The lecture is 20 minutes, 14 minutes, 10 minutes, 20 minutes for the exam, 35 minutes. All right. 20 minutes, 12 minutes. Do you have this time? All right. Do you have this time? You do. You absolutely do. You have 6 minutes to learn about cholesterol. You have 5 minutes to learn about your spotlight. Okay. My videos are not boring. They are going to have you in a mentality. All right. They're going to have you in a mentality that you came to succeed. I'm motivating you the entire way, but I can't do it if you don't have the right resources. And let me tell you, these YouTube videos that I'm doing, that's not it. Okay. That's not it. What I'm doing here is a very, very small portion. Okay. It's really to get you to the next level. All right. The study calendar, this is the next level. Okay. This is the curriculum that you're following. These are the lectures. Okay. This is the curriculum. So you have this. This will tell you, I saw somebody ask, when do you do the case studies? You're not doing the question bank. I don't have you into the question bank until study session number 8. Okay. So study session number 8, that is when you do the question bank. Also, quick facts. You don't start reading quick facts until study session number 7. So that means that you are still able to do all of this first. Where do you find this? Where do you find this? You go to your file vault. It is the 3rd tab. Okay, it's the 3rd tab. When you click on the file vault, okay, click on file vault and you go to course resources. This is considered a course resource. All right, and it's going to load up the files for registered nurse, okay, or practical nurse, whatever you were. Okay, and then it is going to be right here, your daily study calendar. Okay. All right, that's where you find it. You need that calendar. I love this comment. I'm just seeing stuff out the corner of my eye. Maurice says, I had an interview yesterday with a hospital in Savannah, Georgia. The manager asked me what I was using to do my review. I replied ReMar, and she paused and said, oh yes, you're going to pass. What? I signed my offer letter today with a $20,000 sign-on bonus and a moving stipend. $20,000. My gosh. That's like, I mean, you would think you was an NBA athlete, like $20,000 and they paying you to move. Come on, you guys. Y'all have to do this. This is the type of money that, what you gonna do with that money? What you gonna do with $25,000, $20,000? What, probably $5,000 to move? Can I borrow $5? Like, that is insane. That's insane. Maurice, you have to come back. You have to come back. If we don't talk about nothing else, I want to talk about this $20,000 sign-on bonus. That is incredible. And in Savannah, Georgia. I love it. I don't like, y'all, what motivation do you need? What more motivation do you need? This is incredible. Incredible. What other nursing opportunities? Oh my goodness. Wow. I never would have imagined. Let me just ask this question. Is $89 too much for your license? Wow. Okay. What? Brielle says, I think I knew. Did I know that? Brielle says she got a $20,000 sign-on bonus. I couldn't believe it. Like, is that what they're doing nowadays? Is everybody giving $20,000 sign-on bonus? I don't think I got that much. I did get a sign-on bonus. I think it was $3,000. My sign-on bonus was $3,000. Wow. Invest in yourself. Please. This return is crazy. The return on your license already is crazy. Whew. Do you advise doing 100 questions a day while also studying content? I think it's kind of like what Brielle said. And some of you guys who also have passed, I think you do the questions to the point where you feel comfortable. Don't ever sit there and do 100 questions when after 10 or 15, your brain is tired. Don't do that. I don't think that's helpful. I think you do what you have the capacity to do. And if you are consistent, then you will find that you will make progress over time. So if you are hoping to get through V2 in 3 weeks, 4 weeks. You got to be pretty consistent every day. If you want to get through V2 in 10 days or 12 days, you got to be consistent to build yourself up to that. If 100 questions is your goal, you have to have the content to support that. 100 questions is fine, but if you don't have the content to carry you through the 100 questions, then it's not going to be helpful. I honestly would prioritize the lectures, the content first, because you can do questions anytime from anywhere. The content is what's important. Okay. So I'm not going to hold you guys because I really want y'all to get into V2. I do. I want you to get into V2, and at least you can, if nothing else, you could watch pregnancy tonight, and you will see a huge difference, in how you are learning. Get in there, get the program, and get back on the road to success. Okay. Can you please show how to buy the 90 days? So it's simple. Do you advise to use V2? It's really simple. Let me go to the private browser one more time. And all you have to do is put in remarnurse.com. Okay. If you put in remarnurse.com, if I could put it in there. All right, let me show you guys. remarnurse.com course. Let's see if it'll go. Oh, wait, hold on. I got to go to the private browser. Okay, let me try here. remarnurse.com. Okay, so when you go to remarnurse.com, you are going to pick whether you're a registered nurse or a practical nurse. I'll show you how to postpone it, Kim, in 1 second. Okay. And if you'll say you're a practical nurse and you want to get in, get the V2 course. It's this yellow button. You pick the yellow button and you go to the sale price, buy now. Okay. And then you will have the $89 here. Okay. If you want to change your start date, Kim, you just click. Did you see where I did that? Let me just do it again. At the bottom here. Okay. And you go down here to click here to delay your start date. What? Okay. And then you can change it to July. I think you said you wanted July the 15th. Was that what you said? It would be right here. And so then it'll say, your subscription will start July 15th. And that is how you change your start date. Okay. And somebody asked, if I change my start date or delay it, can I go back and change it again? You can. Okay. You can. Maurice says, I definitely will follow up with you. I will take my $20,000 and invest into your product. After spending $4,000 in review fees, including Mark Clement class, I didn't retain anything. V2 is only 10% of the time I spent in recent reviews. However, the only review that I can. Okay. Yes. And I'm glad that even with a $4,000 investment into review programs, you still are pushing towards your goal of becoming a nurse. Because honestly, even if you did pay $4,000, the money that you will make throughout your nursing career is going to definitely over compensate for that. Okay. All right. Can you talk about the free trial and how the workbook works? Free trial. Yeah, sure. So there's also a free trial of the V2 that you guys can try. Let me see if I can go back. So if you want to see the free trial of V2, it'll give you a limited access to the V2. So you can watch some lectures and you can do some questions. Okay. So it'll just be like a portion of it. If you want to sign up for the free trial, let me show you. The free trial, it'll be right next to the paid program. Okay. Now, so it'll be, you just go here and you go to buy now, but it'll be a free trial. Okay. And when you click on the free trial, it will have you to sign up. Now, you do still have to sign up with your name, your email address, and all that stuff. And then when you confirm your email address, you will be able to go into the V2. You'll see the 4 sections. You'll see the 4 sections, and it will, let me see if I can get there. it will look like the full program, but it just won't be. All right. So you'll see, you may see all of this, but you won't have access to the things down here. You only have access, I think, to like maybe these first few videos. And you can download your workbook. You'll have a free trial workbook in the file vault. You can download that workbook and print it out. It'll be like a miniature version of the full book, okay? Miniature version. And you can watch the pregnancy video and fill it out. And the whole idea of the free trial is just, I want you to see the difference. You will immediately see the difference in V2 in the presentation of the lectures. You'll be able to see the discussion board. You'll be able to see the Q bank. And that will give you the confidence to know, like, I won't find another program like this. Yep. Okay. And so that is how my program works. It's really meant to hit every point. It's an all-in-one NCLEX review. So you're going to get the content. You can also jump into the question bank. You also will have the computer adaptive exams. The computer adaptive exams are realistic experiences of NCLEX. The idea of the computer adaptive exams is you're going to take a 5-hour NCLEX. You're going to take a 5-hour computer adaptive exam. You're not going to be able to skip any questions. You're not going to be able to skip any questions in V2. So V2 is going to mimic that computer adaptive exam. Where's my printout out? It's going to give you a printout. Oh, this is my past one. It's going to give you a printout like this, just like your NCLEX exam that'll have below, above. Yep. It will help guide you. You get 2 of those with the course. Somebody says, please throw more light on moving your start date. I want to extend to start by July 1st. Yeah, so you can extend your start date. If you need help doing that, please just email support@remarreview.com. Team ReMar, though, would absolutely love for you to do it when you sign up, because we have a lot of people messaging us, and we want to make sure that we are helping everybody. So the things that you guys can do on your own, we want you to do on your own. Okay. So you can delay that start date. You can delay that start date right when you sign up. What else? I'm definitely getting V2. You must be very consistent. How many quizzes does the CAT have? So there's two computer adaptive tests that you take. The first one you're supposed to take, I want you to take here, and I should put it in here now. After study session, okay, so you have study session 16, 17, 18, 19, and 20. This is your skeleton of what you're supposed to be doing. All right. You're going to take your first CAT exam after this study session number 20. Yeah. And then you should take the second CAT exam about a week before your exam, if you want to. All right. Everything is optional. I think the computer adaptive exams are so helpful, but if you don't want to take them, you don't have to. You should at least take one, though. Okay. You should at least take one. Marianne, it's been 3 years already since your husband passed away. I'm sorry for your loss. And me graduating. Is there a limit on how much time has passed before taking the exam? I think you should be good. It just depends on the state, honestly. I'm not sure what state you're in, but sometimes they want you to take a refresher course or a review course if there's been, some time, but you should still be able to test. Yeah. So it's very important that you postpone before you activate it. So it's better for you to postpone your start date, because I don't think you can't pause V2 once you activate it. You can only extend it. Like, you can only extend your start date. Okay. Yes, this is good. Can you do the trial while you wait for your V2 to be active? That's a great question. You can. So if your V2 is not activated, you still can have access to your trial. Do I recommend the 30-day challenge? Okay, let me talk about this. So the 30-day challenge, when I go into V2, you have your NCLEX review here, and then you have this circle with this young lady. This is the 30-day challenge. So just really briefly, if you click on it, you're going to go to the 30-day challenge videos. Now, the 30-day challenge videos are an additional help. They're kind of like Monday Motivation or Winning Wednesday, very optional study sessions. The benefit, though, of the 30-day challenge is that there is actually 20 study sessions. And each of the study sessions go along with the calendar. So, for example, if you're doing the calendar, which you should be doing, everybody should be doing this calendar, and you finish study session number 16. So you finish study session number 16, you can go to your 30-day challenge button, and you can literally look for study session number, where is it? 16. And you can watch this video. It's a 10-minute video, and it is going to talk to you about the things. Study session number 16 is going to talk about the things here. Okay. So is it necessary? No. Is it helpful? Absolutely. Everything in V2 is to help you to pass. It just depends on how aggressive you want to be. If you want to be in V2 for 4 hours or 3 hours straight, you can absolutely be in V2 for that long. V2 will keep you busy between the lectures, the question bank, 30-day challenge. We have some success stories now. It will keep you busy. Right now, we're still at the sale price of V2. Somebody asked how much was it? V2, not $200, not $150. V2 is still $89 right now, and that includes all of the core content lectures, the question bank, the computer adaptive exam, not one, but 2 computer adaptive exams, the downloadable workbook, all right now. Okay. I'm trying to give you the good to know information about this program, how you can get started. People are doing it in 2 weeks. The reason people can do it in 2 weeks, because the videos are short, they're not boring. They have a study schedule that they're following, and they're doing the computer adaptive exams. Okay. Somebody asked this question about the VT. If you have my VT workbook, you can use VT for the V2 lectures. Okay. If you want to do that, you can do that. Okay. You're able to also postpone your start date until September. So literally, remarnurse.com, get into the V2, whether you want to start it tonight or next week, as long as you start it before the sale. There's 9 days left for this sale. 9 days left. All right. And then after that, you will not be able to get access to this V2 for everything that we are doing tonight. Okay. I went to the Q Bank. No, the Q Bank has lots of questions in there. Lots of questions. So right now, you said next week. All right. So right now there is a total of, let me go here. There is over 2,000 questions in the Q Bank. So you are able, you're able to do all of those questions. If you want to do 200 questions, 30 questions, that is up to you to do that. Okay. But there's over 2,000 questions. I'm not sure. And I am looking for this. Somebody said, how do you add the workbook? Let me show you how to add the physical workbook. Okay. You have to get it. How do you buy the V2? Okay, let me show you how to add the physical workbook. All right, so if I start over from the beginning and I just go to remarnurse.com, I'm going to go to the main website here and registered nurse, practical nurse. Okay, yes, you do have to create a test. I'll show you how to create a test in a second. Registered nurse, practical nurse. All right, if you go to registered nurse, it's going to say get the V2 course. All right, you're going to get the V2 course here. And this is how you add the physical workbook Okay, so the course is $89. If you want me to send you this workbook, which is, if you don't have a printer, you might as well just have me send you this workbook, because the downloadable workbook, if you go to Kinko's or whatever, you're going to have to pay for it. It's not going to come bound. It's just going to be a whole bunch of pages. So this will be more beneficial for the long term. You just add it. It's called the V2 physical workbook. You just add it to the cart, just like that. Okay. All right. So that is how you add that. Okay. And that is how you add it. And if you don't want it, just take it out. Also, if you already have quick facts and you don't want quick facts, you can just take that out. Okay. All right. If you have, somebody says, can you print it out, please? So if you want me to print it out for you, you have to add it, because there's an additional charge for that. It's $35 if you want me to print out that book and bind it and send it to you. Okay. All right. If you have V2 and you postpone it, you're not going to be able to see the lectures, unfortunately. All right. Because if you're delaying your start date, then that means you won't have access to open the program. Okay. So yeah, that's how that works. The Quick Facts book, somebody asked how the Quick Facts book is arranged. This is the question and answer book. You guys should have this book if you're taking NCLEX, but the content, all right, the content is arranged in alphabetical order. Quick Facts also has a study calendar in here. So you guys, if you just have this book, you can follow the study calendar in here. The content of Quick Facts, though, is arranged alphabetically. The order is alphabetical. So you're going to go over all these topics, and these are the topics that you need to know. All right. Absolutely. All these topics you need to know, but it's in this little book. Now, what I will say is that some people ask, can I just pass NCLEX with this book? It's possible, but what I'll say is the information in this book and this book are not the same. So if you only have this book, you still need to learn from somewhere the content in this book. So when you have both of them with the lectures, that's my total program. Okay. But if you just have this book, you just have half the program. And if you just have this book, you just have half the program. Okay. All right. So that's that. Let me set this out. Let me bring this one up. I'm just going to try to create, if I can, just try to create a test, because somebody said that their test was empty. When you go to the question bank, it won't populate a test for you until you create one. So you actually literally have to click that create a button test. Okay. Congratulations. Okay. So when you get to create a test, you actually have to do it yourself. It's going to give you the option to pick from all of the categories, whatever have you. So you have to start by naming your test. Yes, Crystal, thank you. So you have to start by naming it. So I'll just name this Winning Wednesday test. This is also where you get your computer adaptive testing from. Don't try to read it. It's probably very blurry. I'm just trying to show you the general layout. So you can do a tutor test, a regular test, or your computer adaptive test. This is where you would activate whether you wanted to do a computer adaptive test or not. Remember, once you activate your computer adaptive test, you cannot like pause it and come back later. It will begin a countdown for you. You have to finish it. Okay. I like that question. Patience. What do you study first? Quick Facts or V2? You go to the study calendar. It tells you the order to study stuff. You actually start studying your lectures in V2 first. If you're following the study calendar, then you do the lectures in V2 first. Okay. So don't start this computer adaptive test until you're ready. Don't start the computer adaptive test until you are able to sit down and be there for the 5 hours. It took me 4 hours to do my first one. It took me 2 hours, almost 2 hours to do my second one. You have to, you just have to be ready for the entire thing. I don't know. I can't explain why it took me so long. It just did. All right. You can also determine the questions that you want to do, whether you want to do easy, moderate, or hard. easy, moderate, or hard when you're building out your test. And then you can also do your subjects. So it is up to you what types of questions you want to do. I just say just get in here and do them after you do the content. All right, easy, moderate, or hard. You can do all of the subjects, or you can do just some if you want to do the case studies. All right. You can just do case studies, but it's really up to you what you want to study. The benefit of it is you being able to do these case studies, to time yourself, to work on your timing. Very, very important. Okay, the question was, I got to put the type of test it is. Okay. This question bank does have partial credit in it. I think that's one of the benefits too. You will get partial credit. You will get all of the new formatting questions in the Q bank for you to practice at your own discretion. Totally up to you. All right. So if you're looking for a place to do the clickable charts and get timing with that, and these questions are going to help with your reading. This next gen NCLEX is way more reading than before. And so it's very important for you to be able to not only be familiar with these question types, but also go ahead and practice the reading skills that are required. The question bank will do that. If you want to start the question bank right away, you can jump right into the question bank on V2. You don't have to do the content. So it's really going to serve whatever purpose you're looking for. They're just, honestly, I would suggest using the study calendar, but get it how you live it. If you don't want to do the study calendar, then, that's totally up to you too. All right. So it just depends on how you want to, proceed. But if you just want to do case studies all day, you can do case studies. We have enough of them for you to do. All right. And these are the new question types. So it's going to make sure that you answer everything appropriately like you are supposed to. Okay. All right. So I'm just clicking through to show you the functionality of V2. Okay. What questions do you have about it? Good question. I graduated in 2015, never took NCLEX. I need a refresher course. Will ReMar be considered a refresher course? It depends on your state. The V2 can be considered a refresher course. It does meet, a lot of the elements the states require. And just, you got to say you have to look specifically. Some states like Florida will have a specific list that you have to pick from. So that's where. Okay, thank you so much. Yes, absolutely. If you guys have any questions about V2, I am here to help you. I'm going live every Monday, every Wednesday. So you can, come on and we can talk about how to use V2, any new resources, everything new that I'm putting out, I'm putting in the V2 for you guys. All right. Yes, if you have a trial account or if you already have an account, then you have to renew the V2. If you want to keep your progress, if you want to start all over again, you can start all over again, but you have to put in entirely new information because the V2 keeps track of your old information. Do you think passing the CAT is a good sign? I absolutely think passing the CAT, yeah, absolutely. Yes, because the CAT is challenging. The CAT will challenge you. If you could pass the CAT exam, I think you're good for NCLEX, honestly. I hope Alabama takes ReMar. Yes. If you want to watch the video, go ahead. You can jump in there. The file vault, remember, the file vault is where you get your study calendar and your downloadable workbook. You won't see any videos in the file vault. You have to go to the courses if you want to watch the videos. Okay. All right. You're welcome, guys. You're welcome. Thank you so much for rocking with me. We've almost been studying for 2 hours, or at least talking about NCLEX for that long, which is enough to do probably one study session on your study calendar. So I do appreciate you guys spending this live time with me. These questions are amazing. They're great. And at the end of the day, they help you to understand how to use V2. I know it's a new technology. There's a lot of elements to V2, but it's helping nursing pass the NCLEX. And so that's the most important thing. And that's what I'm so proud about. Okay. Somebody, oh yes, I need to say this very quickly. The sale is ending in 9 days. Do yourself a favor and do not wait to the last minute. I have to put this down. And this is what Team ReMar put, because what happens is everybody literally waits to the last day, and then our shipping goes out in the order that it was received. I guarantee you the last day will probably have about 600 or 700 people that will order these books. And so our shipping team will get 800 orders of this book or something like that, something crazy. And people will start emailing right away, when will I get my books? And I'll tell you, the shipping department makes sure that things are very proper. So if there's something missing from your address, you don't put street, you don't put apartment, you don't do something, then they're going to have to send you an email, wait for you to respond, and then they'll ship your books out. So please just do yourself a favor. This happens Black Friday. This happens RNU. Do not wait. Okay. If possible. Now, if you have to, you have to. But literally, even if you order like 4 days before the sale ends, that makes sure that your products get to you before the rush. And that's just that's all I can say. All right. That's it. That's it, guys. Okay. I'm going. Have a great night. It's bedtime. It's bedtime for me. See you Monday at noon. Somebody asked me to do a study session on Friday. I'm debating on it. I definitely am thinking about it. But at the end of the day, do whatever you need to do. Get into V2. Subscribe to the channel. And then if I do a study session, you'll get the pop-up that I'm there, guys. All right. But right now, I got to tell you this: 9 days left for the Get It Done. Get in, get done, get your license. $89 for V2. It's going away. Okay. It's going away. Here we go, guys. ReMarNurse.com. I'll see you guys later. Bye-bye.